Hello there, I'm Stephen Bunting and I'm a physiotherapist working in the northwest of England. If you'd like to know a bit more about me and why I'm making these videos, then click here. Otherwise, let's get on to the matter at hand. Carpal Tunnel Syndrome. But before we get started, please note that this video is for information only and assumes that you're either just interested in carpal tunnel syndrome or you've already been diagnosed with the condition. I'm sure it goes without saying, but obviously this video shouldn't be used in place of a consultation with a healthcare professional. There's a number of different conditions that can cause symptoms similar to carpal tunnel syndrome, and so if you think you might have it, then it's important to get professionally checked out first. Please see the video description below for more information and my disclaimer. Okay, so with that done, let's tackle carpal tunnel syndrome by answering the three most common questions that I'm asked in my clinic. Number 1, what is it? Number 2, why have I got it? And number 3, what can I do about it? So let's get started with question 1. What is carpal tunnel syndrome? Well, carpal tunnel syndrome is classed as a compression neuropathy. Neuropathy is a term used to describe any nerve disorder or nerve disease. It's derived from the ancient Greek, with neuro meaning nerve, and pathos or pathy meaning suffering or disease. So neuropathy is basically a catch-all term, meaning one or more nerves aren't functioning properly and are causing symptoms. The compression part simply describes what the cause of the neuropathy is, and essentially means that the nerve is being compressed somewhere along its length. Now, any nerve in the body could potentially become compressed, but some nerves are more vulnerable than others. The nerves most commonly affected by compression neuropathy are those that pass through narrow areas or are exposed to pressure or friction on their way through the body. The nerve affected in carpal tunnel syndrome is called the median nerve, and it has to travel through a tunnel, the carpal tunnel, in order to get into your hand. We have 3 nerves that supply the hand with sensation and muscle power, but of the 3, it's the median nerve, as it travels through the carpal tunnel, that's most vulnerable to compression, and as such, carpal tunnel syndrome is by far and away the most common compression neuropathy that we see in the upper limb. The carpal tunnel is located just here, on the palm side of the wrist, and it contains 9 tendons as well as our friend the median nerve. Now, the tendons don't seem to mind it when things get a bit tight within the carpal tunnel, and they can usually carry on functioning perfectly normally, but the nerve really doesn't like it. And the symptoms of a squashed nerve can be pain, but more commonly are an uncomfortable tingling, pins and needles, and numbness. And because the median nerve supplies sensation to the palm, the thumb, the index finger, middle finger, and just half of the ring finger, that's the area where the symptoms are felt. We call this area the sensory territory of the median nerve, although in real terms, when the symptoms are quite intense, studies have found that people often can't determine precisely which fingers are involved, and sometimes the whole of the hand and all of the fingers might feel affected. But as a simple test, the next time your hand feels numb and tingly, try testing the sensation in your fingers using a piece of tissue. Remember the map of the median nerve sensory territory? Well, if you notice that your little finger feels more normal when compared to your index finger or thumb, and especially if you notice a difference between each side of the ring finger, well, that's typical of carpal tunnel syndrome. Another test which is sometimes done to help diagnose the condition is a test that your healthcare professional may do called the Tinel's test. Tapping over the carpal tunnel area will sometimes cause a shooting sensation into the palm and fingers, and that's a positive test. Research has shown that the Tinel's test is positive in about 3/4 of people with carpal tunnel syndrome, but this depends on the population that's tested, because it's often negative in the elderly or those who've had the symptoms for a long time. In the population that I see, the test is positive in less than half of the people with the condition. Okay, so now we know what carpal tunnel syndrome is, let's talk about the behaviour of symptoms, because like most musculoskeletal conditions, symptoms can vary between mild and severe. When carpal tunnel syndrome first starts, it's often mild and intermittent. In fact, usually the first symptoms are a tingling sensation in the hand that occur either just at night, first thing in the morning, or when doing certain activities during the day, classically reading or holding a phone. And the reason for this is that the carpal tunnel varies in size depending on your wrist position. In a neutral position like this, the carpal tunnel is at its widest, but in positions of wrist flexion or extension, the carpal tunnel narrows. and these are the typical positions that our wrist adopts when we are asleep, either bent as we curl up or extended if we use our hand as a pillow. And the same goes for activities like holding a phone or typing. So usually the symptoms of hand tingling can be relieved fairly quickly by changing our wrist position or shaking the hand to restore blood flow to the nerve. If the condition worsens, then the tingling and numbness can become continual throughout the day and night, and this can give you a feeling of clumsiness and a loss of dexterity. You might find yourself dropping things, usually not because your grip strength is any weaker, but because that lack of sensory feedback can make it difficult for you to work out how hard to grasp something. In the later stages of the condition, the hand may become continually numb, and the deeper nerve fibres involved in muscle control can also be affected, causing weakness and muscle wastage. The main hand muscle supplied by the median nerve is called the abductor pollicis brevis, or APB for short, and it's located just here at the base of the thumb. A visible wasting of this muscle, as seen here, is an indication of more advanced or later stage carpal tunnel syndrome. So there we go. We now know what carpal tunnel syndrome is and what the symptoms are. So let's go on to question 2. Why have I got it? Why me, and not my friend who's the same age as me and does the same job? Well, the first thing to say is that carpal tunnel syndrome is a fairly common condition. Studies vary in their results, but typically report a prevalence of between 5 and up to 10% in the general population, and this can rise to over 10% in people with jobs involving repetitive hand activities. We know that the most common age group is the 40 to 60 range, but it can occur at any age. We also know that women are more commonly affected than men, but this levels out in the over 70s. So that's the stats, but interesting as they are, they don't really provide an explanation as to why you might have carpal tunnel syndrome and not that friend of yours at work. And to answer this, well, the most compelling evidence we have suggests that genetic factors play the main role as to why some people are prone to this condition and others aren't. And that makes sense really. The carpal tunnel, like most parts of the body, will vary in size from person to person, and some people will have just inherited smaller carpal tunnels than others. So as you can see, a combination of genetic factors plus environmental factors like jobs and hobbies are the main reasons why people develop this condition. It should also be noted, however, that certain other medical conditions can also affect nerve function and make someone more vulnerable to developing neuropathies such as carpal tunnel syndrome. This is a long list and beyond the scope of this video, but includes things like diabetes, thyroid disease, alcoholism, and some vitamin and mineral deficiencies. Okay, so we've now discussed what carpal tunnel syndrome is and why you might have it. So let's move on to question 3. And if you have carpal tunnel syndrome, the one which I'm sure you'll be most interested in, what can you do about it? Because it can be a really uncomfortable condition. Anything that disturbs sleep can affect your general well-being, mood, and quality of life. So the first thing that will usually help, particularly if symptoms are intermittent and mainly at night, is controlling your wrist position. If you can avoid those positions that narrow down the carpal tunnel, then that usually helps with symptoms. And the easiest way of doing that is by wearing a wrist splint at night. Something like this will help keep your wrist in a neutral position and prevent the nerve becoming squashed. The right type of splint should have a thin metal bar sewn in, which you can remove to wash the splint if it gets a bit grubby. That should keep your wrist in the correct position. If you have mild intermittent symptoms, then there's a good chance that using a splint every night for at least 6 weeks will allow the nerve to go through its normal healing process, which in carpal tunnel syndrome is getting disturbed every night when the nerve gets squashed. So wearing a splint at night is not just about helping to relieve symptoms, but it's also about trying to cure the condition by encouraging the nerve to recover naturally and heal itself. If you get daytime symptoms, then you can wear the splint during the day and it will help, but its main use is at night. You see, during the day, if you hold a phone and get hand tingling, well, because you're awake and aware of the tingling sensation, you're going to automatically change your wrist position in order to relieve the symptoms. At night, though, the nerve could be squashed for a good few hours before the symptoms become intense enough to wake you up. And when the nerve is squashed every night like this, for hours on end, sometimes over weeks and months, well, that's what interferes with nerve healing and can cause nerve degeneration and worsening of the condition. So you can see that using the splint at night is an important treatment for carpal tunnel syndrome and far more important than using it during the day. Of course, if you have a job or hobby that involves repetitive wrist activities, then you're going to need to think of ways of reducing the strain on your wrist. You might be able to wear the splint during these activities, and that should help. If you have a desk job and your symptoms are being aggravated by prolonged use of the mouse or keyboard, then consider getting an ergonomic assessment of your workspace. Poor workplace posture can be a major aggravating factor for carpal tunnel syndrome and can usually be improved fairly easily with some simple changes and better equipment. I'll put some links in the description below which provide more information about workspace ergonomics. The other thing that people often ask me about is medication. Are there any drugs that can help? Well, there is evidence that using anti-inflammatories for a few weeks can help by reducing swelling around the nerve, particularly in the early stages of the condition. Tablets and topical gels and creams can be used, but please discuss this with a healthcare prescriber or pharmacist first. The other treatments that can be considered if symptoms still persist are injections and surgery. An injection of corticosteroid, also known as cortisone, into the carpal tunnel can relieve symptoms in most cases, but the effects can sometimes only be temporary. In my experience, if symptoms are intermittent, meaning you have no symptoms for at least some part of the day, then an injection is more likely to be effective in the long term. But if your symptoms are continual, then an injection is less likely to help in the long term, as symptoms typically return after a few months. If you have visible muscle wastage around the thumb, then an injection is unlikely to help, and you probably need surgery. The operation for carpal tunnel syndrome is quick and simple, and usually done under local anaesthesia. It often takes the surgeon less than 10 minutes. The procedure involves a small cut in the palm, usually a few centimetres long. The surgeon can then see the ligament that forms the roof of the carpal tunnel. This ligament is then cut to relieve the carpal tunnel pressure. You usually have a few stitches and a large bandage to keep your wrist still and supported until the stitches come out in about 10 days. In my experience, it's best to plan for about 6 weeks off work, especially if you have a manual job, as the wrist can often be quite sore for a while afterwards. Of course, your hand surgeon will be able to advise you more specifically about this according to their typical results. The very latest surgical techniques involve 2 tiny needlepoint incisions and use a thin wire under ultrasound guidance to cut through the ligament like a cheese wire. These new procedures have a much shorter recovery time, and although they're only offered at specialist centres at the moment, they will become more widely available in the future. Interestingly, the ligament that is cut in surgery will heal over again within a few weeks of the operation, but it tends to heal with less tension than before, and therefore with an overall reduction in carpal tunnel pressure. Finally, I also get asked about exercises that might help. Unfortunately, the evidence to support exercises for carpal tunnel syndrome is somewhat limited, but that's mainly because there aren't many good studies out there that have looked into their use. There are some small studies that have found that nerve sliding exercises can be helpful, and in my experience, they can sometimes be helpful, but usually only in the early stages of the condition and when used alongside some of the other treatments that we've already discussed. Exercises, however, can be helpful after surgery in order to prevent scar tissue formation and therefore to help get the best post-operative results. You can see a video that describes these exercises here, and I'll also provide a link in the description below. And that's it. Well done for making it to the end. Hopefully you now know a bit more about carpal tunnel syndrome and, more importantly, what you can do to help get it better. Of course, it's important to reiterate though that carpal tunnel syndrome is only one of many different conditions that can cause symptoms of hand pain and tingling, and so if you have symptoms you should always seek professional advice and get a diagnosis first. Okay, well thanks very much for watching. If you found the video helpful or you have any suggestions, then please leave a comment below and hit that subscribe button, as I'll be posting more videos of other musculoskeletal conditions in the near future. Until then, take care and bye for now.